Welcome to the Chronic Pain Workshop, Eliminating Chronic Pain for Life, for good. How do we do that? This may seem like too big of a task. You may have had pain for a long time. You may be suffering, taking pills, getting shots, trying chiropractic care. You're wondering, why hasn't this helped? So we're going to jump right into this and begin. And this is exciting stuff. So when we look at how to eliminate chronic pain, we're going to discuss the different types of pain so you can identify what type of pain you have so then you can go on the right course. Not everyone needs chiropractic care for chronic pain, but more certainly not everyone needs drugs and bag full of vitamins and stretching and exercise or shots or surgeries. So we're going to identify the different types of pain that we have. So we were created to be alive and healthy, not living in pain, dysfunction, disease. But unfortunately, this is what we see in our society, especially in America. We're here to reclaim your health. Let's get it back. We have a mission statement in our office based on Proverbs 24:11. Rescue those being led away to death. Why do we say that? Because if we don't get the right diagnosis, the right understanding, and we lead into drugs and surgery, that could be the end of us. It's happened to some members of my family. We've seen it happen with thousands of patients over the years, or they get to our office and they have been misdiagnosed, wrongly treated, and now we have to rebuild what we can. So right now, around 21% of all U.S. adults have chronic pain, with 7 to 8% experiencing high impact chronic pain. And that's 7%. 17 million people experiencing high impact chronic pain, which restricts the ability to work or participate in daily activities. That's playing with your kids, playing with your grandkids, going for a walk, biking. So I'm 59. You'll get to hear my story at the end. I'll tell you how this just transformed my life. But I'm 59. I've had a lot of trauma, yet I don't live in chronic pain. I've had a lot of injuries to my body, yet I'm still able at 59 to be able to play rugby with 20 and 30-year-olds. And I'm going into another season. I'm ready. It's exciting. Maybe a little crazy, but I'm able to do it. And I don't have to live in pain. So why does pain exist? First of all, it exists for a reason. You have pain. Don't ignore it. Don't just cover it up. The central nervous system, your brain and spinal cord, and the nerves are submitting pain, letting you know through communication, hey, something's wrong. If you were to touch a burning stove, a hot stove, you would immediately pull your hand back and it would burn. It would let you know that something is wrong. That's proper. And you would have pain from that. But don't look at pain as something that's bad. Looking at it as a warning sign that something is wrong, like your check engine light in your car. When that comes on, even though you don't like it to come on, it gives you a fair warning to get it taken care of before the engine blows, before something significant happens. And this is what we're doing, unfortunately, with drugs. We just cover that up, go on. We're busy. I got life to live. I got a busy day ahead of me. So I take the meds so I can get on with work. So don't think pain is bad. Pain is your friend. It's letting you know something is wrong. It's what type of pains do you have? So there's three main types of pain. Muscle pain. That's the green area, right in the muscle, right in the belly of the muscle. That's a leg. So if you have muscle pain, that may just be you strained your muscle. You have a slight tear. You may just need to ice it, give it a little rest, and some gentle stretching. And if it's just that, if it's a muscle strain, it will heal up within a few days to a few weeks and you'll be fine and on you go. You don't need a doctor. You don't need shots. You don't need medication. You don't need a chiropractor for that. Our body's in a state of repair and regeneration every day. I've had many muscle tears. I don't do anything for them. I ice them. I give them rest. I do gentle movement to keep blood flow, and on I go. And they heal up and I'm back playing rugby again. Joint pain is a little different. So joint, that's the red area, right in the middle of the knee, right? It may be chronic degeneration or arthritis, but moving usually aggravates this. Moving usually causes pain in that area. Or every day you're getting up and it just aches. It's constant. It's like, oh, man, my knee, my elbow, my shoulder, it aches. It aches. When you rest, you get decreased pain. So this is typical of a joint being arthritic. And many times you have to get an x-ray to see how bad the tissue is, how bad the disc is, or the bone, and is there arthritis? Is it bone on bone? Is there still space? And then once you identify how severe it is, then you can go on a course of action. Many times, some gentle stretching exercise done properly will allow the joint to heal, restore itself, and maintain itself. So you don't need drugs or surgery, and some supplements help joints like this too, and we'll discuss this later. Subluxation, this is where the bone shifts out of place and it hits the nerve. The nerve is part of the central nervous system. So we're going to talk about, where these nerves go, but that's the picture of a guy's neck, and the nerves in the neck go out of the neck through the shoulder, down the elbow, all the way to the hands and fingers. So this is nerve pain. So when a subluxation hits, it can be painful. We'll discuss this in a minute, but it can be painful. Many times it just comes and goes. You're like, man, my arm hurts, but it doesn't hurt all day. I wake up, it hurts, but it goes away. At night, it hurts. It continues to get worse with or without movement or injury. So that's typical of a subluxation. It's out of alignment, irritating the nerve, agitating the nerve. So with certain movements irritate it, certain moves help it, but it never goes away. It's like, why isn't this going away? And many times it's in either one part of the arm or the whole arm is aching. And we'll discuss how to fix that. So those three types, if it's a muscle and you use ice and stretch and it goes away, you're done. That's it. If it's joint, you need an x-ray, you need a diagnosis, you need some further testing to see. A subluxation, you need a spinal x-ray, and you need a chiropractor to analyze that to see, is there nerve being compressed? Because if the nerves are compressed, it will get quite serious as you age. So here's another thing, stretching and exercise. Stretching is good when the muscles are tight. You get a good warm up in 2 to 5 minutes warm up, and you do some gentle stretching. If it's a tight muscle, the muscle relaxes, you feel better. That's good. But if you have a subluxation where the bone is out of place hitting the nerve, and that's causing the tension or the irritation, stretching will make this worse. So many times you're trying to stretch through a subluxation, a joint out of alignment, you're trying to push it, and it doesn't want to move. So it just aggravates it. It's like, when your car is out of alignment, you're trying to drive your car, so you drive it more and more, thinking that's going to be better. It's going to wear it out. So this is where you need to have a proper diagnosis. You need an x-ray to see where is the problem. If it's a simple muscle problem, stretch away. I would encourage that. I'm big into fitness. I wouldn't be playing rugby at 59 if I hadn't been all these years. So I understand how stretching and exercise is good and how it can be absolutely horrible too. Exercise. So if you have tight muscles or weak muscles, exercise is good. You go out for a walk, you do some squats, you go to the gym, you're doing lunges and movement, you're carrying kettlebells, and you're working those muscles, getting blood flow in those muscles. Exercise is going to be a great way to heal that area, relax the muscles, get it stronger, get the muscle viable again, and you're fine. But if you have subluxation and there's degeneration, arthritis, or the disc is being compressed, any of that, when you exercise, again, it's like driving your car when the car's out of alignment. The more you drive it, it's going to accelerate the aging process 6 to 10 times faster than normal. So many times we hear, I tried exercise, it doesn't work. It irritates me. So I'm just not meant to exercise. I'm getting older. And it may be that your spine is not moving properly. You need to get alignment back in. Then you can exercise. And then you put those two together. Wow. Now you have a powerhouse. Now, not only does your joints heal and your nerves heal, but now your muscles and your whole body heals. So ice or heat. We hear this all the time. We misuse this all the time. Heat. Listen, this is really important. If you have an acute injury, something you just damaged, you twist your knee, and when you were running, you step in a hole and it twists and it hurts, it's inflamed. You don't want to put heat on it. Heat inflames things, like your ring in the summertime. You can't get your ring off because you're inflamed. Your heat swells you up. So ice is always good for acute condition, and it's usually never harmful. So you're always safe with ice. So if you don't know, always remember ice is safe. Use ice before you use heat. So if you have an acute injury and you use heat, it'll feel good, but it'll swell up more and it'll be more painful later. So you have to use heat again, heat again, heat again. Like this isn't working, so then you take drugs. So use ice. Heat is good for chronic arthritis or old injuries. So you have an injury of 10 years ago and it's just tight, stiff. Kind of like when we were showing the muscle joint or subluxation, the joint is stiff. So you put heat on it or put heat on the muscle to warm it up, and then you go exercise, it feels great. That's when heat is good. If it's nerve pain or inflammation or acute injuries, heat is horrible because it inflames it. It traps the nerve more and it causes more damage. Like that knee there that's hot and irritated and swollen, you wouldn't put heat on it. You'll make it worse. You ice it. So those are very easy to remember. Ice is always safe. Only heat is, for chronic arthritis or old injuries. And after you put heat on it, you use it, it feels better, then you're safe. That's good. That's when you use heat. Medications or supplements. So big dilemma. Well, I tried supplements, they didn't work. I'm taking meds and they worked. Well, here's the thing with medication, and this is our dilemma that we have in the United States, is we rank 79th out of 81 in total health index of the 81 nations, top nations. The top 3 killers are heart disease, cancer, and medical errors. And medical errors from 250,000 to 440,000 deaths a year. If you Google that and look that up, you may find that they hide that a lot. But Gary Null, if you look up death by medicine, you'll find that he did a report in the early 2000s, and he's found that 1 million deaths are attributed to medicine and medical care, medical errors a year. So that would make it the #1 cause of death. So when we go and we're looking at medication, I understand, when we're in horrible pain, I've been there, I've had injuries, and I needed some medication to just ease my pain and suffering for short term, but I didn't want to stay on it. When we look at pain medication, it's addicting. It can cause respiratory depression, stomach issues. It causes bleeding in the stomach, heart issues, including risk of heart attack and liver damage. Kidney damage. You'll hear this stuff. I know it causes liver damage. What else should I do? We're going to explain that. NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen. Heart attack or stroke risk increased even with short-term use. It may begin within a few weeks of starting. Opioids, you've heard the epidemic on opioids. This is horrible. There are approximately 81,806 opioid overdose deaths in 2022. What happens is you get injured, they put you on short-term use of opioids, you get addicted, and next thing you know, you're going down a very dangerous path, and then fentanyl and everything else kick in. And you got to be very, very cautious of that. Your body can heal itself without pain medication if you are working with the right doctor, if you know what you're doing. One supplement we have is called platinum turmeric. It is a reducing inflammation and healing joint tissue supplements. So supplements can help. They're not as fast acting as drugs because drugs are quick. You get results right away. That's why we love them. But supplements are more subtle, slower. They have to be digested and utilized in the body. But things that can reduce inflammation, 1 is fish oil, 2 is turmeric. And we have a turmeric that has glucosamine, other supplements in it. You'll see chondroitin in some supplements. Vitamin D3 is a natural anti-inflammatory, helps. Nitric oxide, another one, increases blood flow, circulation, and is an anti-inflammatory and healing. Probiotics, same thing. So those are probably our top. We don't sell a lot of vitamins in our office. I don't like putting people on a boatload of vitamins. Taking a few here and there are good to supplement our diet and exercise along with chiropractic care. But if you haven't tried any, these would be a good base or foundation without spending, $5,000-$10,000, on a supplement, protocol for a few months. And I've seen that happen way too many times. Chiropractic care lowers use in spinal pain. So they did a study in 2022, and they found that patients receiving chiropractic care for spinal pain were 1.5 to 2 times less likely to fill opioid prescriptions compared to those who didn't, especially when care began early in the pain episode. So research is out. They know this. They know chiropractic care can reduce pain and keep people from the pain medications, which is just very important. When we look at nerve flow. You can see the spine here and how the spinal cord, brain and spinal cord connect and all the organs, and you know how that works. And we look at the nerve going to the heart. What would happen if you cut the nerve to the heart? If I took a pair of scissors and I snipped that, what would happen? And everyone says, well, stop, it's done. Well, you disconnect it from the brain, you cut the nerve supply, you kill it. But what if that nerve, that red nerve where the subluxation poster is, that nerve went to the heart and you pinch the nerve? Would the heart wouldn't die, but would it function optimally? And again, everyone would say, no, it couldn't. You're blocking nerve supply. You're blocking the central nerve system. Well, did you know that, that only 10% of the nerves are pain sensitive? So many times you can have a subluxation in your back or neck area that supplies your arm and you'll have arm pain. But did you know those same nerves in the upper back, lower neck area go to the heart and the lungs? So 90% of the nerves go to your organs, glands, and hormones. So this is where proper diagnosis is critical. Do you have joint pain? Do you have muscle pain? Or do you have a subluxation? Is your spine out of alignment that finally caused pain, 10%, but you may have other issues contributing from the subluxation. You may have acid reflux if it's in your back. You may have digestion problems, IBS. You may have asthma. You may have AFib. I've seen all this in my career in chiropractic, and I've seen many of these conditions not only improve, but heal completely if it's truly from a subluxation. The only way to know that is through a proper spinal x-ray. So this is where it's very, very important to get the right diagnosis, because if you're truly having a heart attack, you need a doctor. But if it's a subluxation causing heart problems, you may need a cardiologist, but you need to have that subluxation corrected so it doesn't progress. And that's with any muscle pain, joint pain, or disease process in the body. So here are two x-rays. Here's a neck x-ray with the curve in the neck looking sideways. The curve in the neck, curve in the low back, we should have a big bend that acts as a shock absorber, that absorbs motion. That is critical to have a curve in the neck. And it's unfortunately with the amount of technology, we don't see this anymore. We're seeing, because we're sitting like this all the time, tucking our head down, looking at computers and cell phones and everything else, we're losing the curve, which can accelerate damage to the spine, accelerate pain, and health conditions. And from the back view, this is the pelvis, but the entire spine should be straight like that red line. It should be completely straight. There shouldn't be curves and twists and bends in the spine, scoliosis. So we get to see with an x-ray, you get to see, and you can even see the pelvic joints, the hip joints, the hip sockets. So it's nice clear space in the hip sockets. Those should be clear. The shoulder should be clear. The knees should be clear. And the spine should be clear as well. So what we tend to see are spines like this that are bent backwards, and those three discs in the middle, you can see that they're not big and fat. That's disc degeneration. So that's bony arthritis, disc degeneration caused by subluxation. That's the x-ray looking behind. That should be straight. So look how curved that is. Where that red arrow is, where there's disc bulges, disc compression. You have a massive disc problem, and that scoliosis is causing degeneration in the spines. Dr. Sperry, Nobel Prize winner back in the 70s, found that 90% of nourishment to your brain, central nerve system, this runs everything. This is very important to understand. 90% of nourishment to the brain is from movement of the spine. So when you see spines like this that are rotting away, decaying, is there going to be proper movement? No. Is there going to be proper brain function? No. The brain's going to get malnourished. What can happen? We can lead into brain dysfunction diseases as we get older. So again, only an x-ray is going to show this. When you see this on your tire, you wouldn't assume you bought a bad tire. It's the alignment. Bad alignment equals wear and tear. So do you want to fix the symptom, the tire? Do you just say, oh, you know what, just change the tire. I'll come back every 3 months and get new tires. You'd be a fool. That'd be stupid. Or do you want to correct the alignment? You need a new tire, so you need to fix that. But you need to correct the alignment so this doesn't keep happening. That's the same thing with the spine. But unless you get an x-ray of your spine, you won't know. Is the alignment good or bad? Is it a muscle problem, a joint problem, or the spine and subluxation? So the power of the adjustment, one, joint mobility. As soon as you get adjusted, you have range of motion increase immediately. I see it every day in my practice. Somebody gets adjusted and they, oh my goodness, I can look out the car window now. I can bend and move. You release muscle tension. So many times muscle tension is not caused just by a bad muscle. It's because of joint isn't moving from a subluxation. You increase range of motion, but it also stimulates the nerve and it releases nerve stimulation. In fact, every adjustment, you boost the immune system, the white blood cells by 200% after one adjustment. Bam! How powerful that is to allow healing to be restored. You decrease cortisol, the stress hormone, relax, increase serotonin and dopamine, the happy. Man, you just feel like, I feel good after an adjustment. That's why, because you're releasing these stress hormones and you're increasing the happy, bubbly, healthy hormones, and you decrease pain receptors. So you get done and you're like, you know what? I can move better and I feel happy and I don't have as much pain. So you can imagine if you keep this up and you keep proper range of motion, how good you will feel. They also did a study and they found that more visits equaled more rapid improvement in a clinical trial with chronic low back pain patients. 3 to 4 chiropractic visits a week over just 3 weeks. 3 weeks. It's significantly greater reductions in pain and disability. So not mild, significant greater reductions. So sometimes you need rapid adjustments to clear this out, but in just a few weeks, you can feel brand new. Manual spinal therapy for acute low back pain. There's different types of chiropractic care. We do a mix of things here, probably anywhere from 6 to 10 different types of adjustments, and one of them is manual adjustments with our hands, which I love the most. And it's very gentle. It supplies immediate motion, but it's statistically significantly relief from lower acute low back pain compared to a sham or no treatment, and had comparable outcomes to standard care. So listen to this. So they would fake adjustments, nobody got better. They had no treatment, nobody got better. But when they adjusted them, they got better compared to standard care. Standard care is drugs and surgeries. So shots and drugs didn't have anything better than getting adjusted. That's powerful. So you just need a little bit of time. It doesn't happen after your first adjustment, but usually we see within 2 to 3 weeks, patients are like, doc, I'm feeling great. I don't have this pain anymore. I feel great. Chiropractic care improved quality of life and brain function. So remember, the brain controls all function and all healing throughout the body. So a recent clinical study reported significant improvements across multiple domains, including pain intensity. So that's another thing. Your pain levels will drop because you're improving the brain and spinal cord nerve improvement. You're going to decrease pain sensitivity. Fatigue, anxiety, and depression after only 4 weeks of chiropractic care. So here's another study. Just within a month, you decrease pain, your fatigue, anxiety, and depression improve, and you feel better. So what they found was neuroplastic changes were observed in the brain networks associated with chronic pain. Chronic pain will destroy your brain. Chronic pain will destroy your body. It just keeps beating it up and just, man, it's like acid to the body and the brain. It just irritates the heck out of it. So neuroplastic changes mean the brain is actually healing. They're seeing observable healing components happening to the brain, suggesting deeper nervous system benefits. So because the brain and spinal cord control everything, when you improve this, overall, your entire body is healing, which is so powerful. So why do I do this? When I was young, I wet my bed until I was 9 years old, and then I had stomach issues in 4th grade all the way to high school. By the time I got to high school, I couldn't make it to the bathroom in time. I had horrible IBS. I couldn't make it to the bathroom, meaning I was pooping my pants in high school. I'm like, why is this happening to me? Yet I was a very good star athlete in school, so physically I'm fine. I'm strong, I'm fast, I'm agile, but my bowels were a problem. One day I bent over and my back just seized up on me. My lower back, right side, went to a chiropractor. He adjusted me, didn't explain anything, didn't take an x-ray. I had no idea what he did. He didn't explain or educate me or my dad. My dad at the time was 47 and he had heart disease, and my dad was dying. He was on a bunch of medications, and the chiropractor said to me, Aaron, if you're in pain, come back next week. Not several times a week for 2 to 3 weeks or a month. didn't explain anything. He just said, come back next week. Well, one adjustment, I was out of pain. I was young. I caught it early, out of pain completely. 2.5 years later, my dad dies of a heart attack at age 50. And now I'm 59. So at 50 years old, my dad dies of a heart attack. I lose my dad. And at that point, I'm studying health and physical education at Slippery Rock. And I said, I am not dying at age 50. I'm figuring this out. This was horrible. This ruined our family. If you've ever lost someone like that in your family, it's devastating. And years later, I'm a phys ed teacher in Florida playing competitive rugby, lifting weights all the time. I was a fitness instructor in the gym. My back does it again. So I went to the medical doctors and they want to give me drugs and they said stretching. And I'm like, that doesn't make sense. I stretch. It's not that type of pain. I didn't really understand everything I know now, but I knew it wasn't the right answer. So I went to a chiropractor. He took an x-ray, and the x-ray, my pelvis should be balanced. It was out of balance, right where I had pain. I thought, that makes sense. An x-ray showed where I had the problem. And he discussed, and if you get it adjusted, it will free that up. But those nerves in my low back also go to my bowels and my bladder. When you pinch a nerve, if the nerve goes down your arm, you have arm pain. If it goes into your back, you have back pain. If it goes to your bowels, you have IBS, or your bladder, you wet your bed. Like, this could have saved me as a kid. Oh my goodness. So I was very intrigued. I want to get out of teaching. I went to chiropractic school. And for the last 35, 36 years, I've been IBS free, drug free. My bladder's fine. All my organs are fine. And I still play rugby and I still have a farm. And what happened was 10 years ago, I fractured my scapula. This is me in the hospital. I fractured my scapula riding a bike. I was 49 years old, wrecked my bike and broke my scapula. Very severe injury. They didn't expect me to do even a push-up within the first year. It's a very slow healing injury. I could have died. I could have broke my neck. Praise God, I didn't. And I lived through it, but the pain was unbearable. They wanted to put me on opioids. And I said, no way was I having that. I confronted the doctor. She was very rude and just said, well, you don't know how bad your injury was, and walked away. And I had to take ibuprofen, which I knew it increased risk of heart problems and stroke, but it was the only thing I could do along with my supplements to get me through, the few weeks that I had to take it. And then I got off it. But with the right chiropractic care, the right diagnosis, the right understanding how my body heals, my body healed. Within 2.5 months, I ran a 5K race in 21 minutes with my son, Aaron. And then 5 months into healing, I bench pressed 225 pounds. And then 8 months later, I was playing rugby again. So I had very specific chiropractic care, specific exercise. I had a healthy diet, and I took the supplements, and I didn't take medication, surgeries, or opioids. And that allowed me to rejuvenate and heal. And I'm back playing rugby. And if I had a bigger picture, you'd see these young guys, they're 20 and 30 years old, and I'm still able to do that today. So if you've been suffering pain, one, you have to get a proper diagnosis. And without a right x-ray or analysis, you're left in the dark. So we are offering something very special. And when you come into our office, our team of doctors and staff, we've all been in your situation. We've all had things happen to us, trauma, damage. We've all been broken in different ways and experience this healing process. So our goal in our office is to help you dominate your health. We'll help you regain your health and live pain-free, healthy for the rest of your life. So the offer, when you look at the insurance rates, and this is where it just gets absolutely crazy. When you bill an exam and consultation, it's around $75. When you go through the orthopedic testing, neurological testing, posture evaluation, spinal exam, it's around $150. Digital x-rays for 2 to maybe 4 to 6 x-rays can range anywhere from $150 to $300 for a set of x-rays. And if you've been around, you know I'm not exaggerating these. The first treatment can be $60 to $150. Review of the results and the consultation afterwards and the x-rays of all the tests can be $75. So that can range anywhere from $510 to $750. We value that in our office, $349, but we have a special offer for only $47. And what this does is it gives you all your testing, all your exam, your posture evaluation, your bilateral scale, your digital x-rays, whether we take 2, 3, 4, 5 x-rays, they're all covered. We are including the first treatment, whether it's a decompression sample or an adjustment. And we will go over all the test results with you to come up with a plan. If this is your problem, we can help you. We will sit down together and come up with a plan to help you get well. We do this all for only $47. So that way we don't have to go through the insurance. It's only $47. When you click on the link below, you'll go to our scheduling app. You schedule new patient, and when it says, when you schedule your time, it will ask you where you heard this from. Hit webinar. So my staff knows that we are including the adjustment or first treatment or decompression. When you sign up through our website, that's not included. So you get a special bonus by sitting through the webinar, and I hope this helps. So all you have to do is click on the link below. If you're interested, you'll go through the entire exam, process. We'll sit down, listen to you, and we will listen to you. We'll do all the testing we need. We'll take the x-rays, then you'll have your first treatment, and then we'll sit down and come up with a plan to help you. And if we can help you, we will. If this is not your problem, we will let you know, and we'll find you somebody that can help you. So I hope that helps. And again, you can rewatch this over and over to better understand it. But if you're looking for help and you've been suffering too long, you're saying, this is enough, for $47, you're going to get all your questions answered. And if it is a problem we can help, we'll give you a plan. If it's not, we'll find somebody that can. So I hope that helps. If you have any questions, you can go to my website, email us, message me. I'm all over the website because I love teaching this stuff. So just message me, reach out. We'll do anything we can to help you, so your life can be like ours and our staff, that we beat this. We're living an amazing, healthy life. And I don't know how long I'm going to play rugby with 20 and 30-year-olds. Maybe I'll start playing with old guys like me. But I'm able to live the life I want to live without pain and being fully functional with 5 kids, 6 grandkids, and an amazing life. Praise God. Thank you for listening, and just click on the button below.